dysplasia sequence. Both conditions are associated with poor prognosis. So this was the case of trisomy 18 in a fetus, which showed persistent clenched fist with the index finger overlapping with the third digit. And there was also a blind ending esophageal pouch, which was esophageal atresia and FGR. So all these features are suggestive of trisomy 18. So another alignment abnormality in upper limb is persistent adducted thumb that is seen in both the hands, which is documented in 2D and 3D images here. There was also obstructive hydrocephalus here and partial agenus of corpus callosum with interhemispheric cyst. So the next step is to look at the perineum. If the fetus is male, then it adds on to the diagnosis of X-linked hydrocephalus due to L1CAM mutation. So when there is an observation of persistent hand clenching and or adducted thumbs, it can suggest the presence of neuropathic disease, even in the absence of structural brain anomalies. So genetic testing has to be offered in such cases in the form of gene panels, CMA, or exome sequencing. Next alignment abnormality is persistent abducted thumb that is seen in both the upper limbs in this fetus here. And there was also persistently abducted grade 2 in both the feet with rhizomesomelic shortening of all the 4 limbs. So this is suggestive of diastrophic dysplasia. So next alignment abnormality of upper limb is clinodactyly, where there is permanent incurvature of a finger, most commonly the little finger. This is because of the asymmetric hypoplasia of the medial aspect of the middle phalanx than the lateral aspect. So approximately 60% of newborns with trisomy 21 is associated with bilateral clinodactyly. So these cases warrant detailed ultrasound examination. So in non-isolated cases, invasive testing and array is recommended. In 18% of the cases, clinodactyly may be isolated. They have a good prognosis and there's no need for postnatal surgery. So this is a case of clinodactyly. You can see a very short middle phalanx of the 5th digit here. And there were only 11 pairs of ribs here. The deformity is best seen in the coronal planes. So this was a case of trisomy 21 confirmed by karyotyping. This is another case of clinodactyly in both the hands where there is absence of middle phalanx in both the hands, echogenic bowel, intracardiac echogenic focus in the left ventricle, and unossified nasal bone. All these features are suggestive of trisomy 21. Now, next case of